So imagine we spent as much time making a postpartum mental health checklist as we do for our hospital bag checklist. Whether or not you're a parent, I'm sure you've seen these on the internet about packing your hospital bag. But what should we do for our postpartum mental health? And that quote comes from Psyched Mommy Instagram page, Dr. Reem. Postpartum is the period after delivery, and it refers to the mother. Postnatal is for baby, postpartum is for mom. When I was doing a little bit of research, the Canadian surveys from our government, nationwide, only report 7.5 of postpartum women experiencing symptoms of postpartum depression and anxiety. 13% of those women have little to no support available of them. However, Mothers Program Canada reports 1 in 5 postpartum women experience anxiety and depression. So from my intro, you can probably assume that I am one of those women. No one told me about postpartum depression or anxiety after my first baby. It was something I had to experience on my own. After my second baby, I kind of had a little bit of a heads up. And by my third baby, my midwife and I were discussing during my pregnancy what I can expect for my mental health. However, mental health and postpartum depression, it's not what you see in the movies for everyone. For some people, it might be sadness. For some people, it might be a little bit more than baby blues. But for me, it was more anxiety and rage. Now, this doesn't exactly mean that I wasn't happy to be a mother. It didn't mean that I was upset at my children or that they did anything wrong or that I was a bad mom. It just means that the way my body is coping with all of these new hormones, adjusting to little sleep schedule, breastfeeding, and navigating small humans as well as a new baby, just kind of brought out a different side of me. However, I find it's not very talked about. On the surface, my friends saw someone, and my family, they saw someone resentful, who would outburst, who had a short fuse, who wouldn't answer text messages, who was nitpicky. Those are some of the descriptions. But below the surface, I had unmet needs, struggling to adapt, burnout, loneliness, intrusive thoughts. These are all signs and symptoms of postpartum depression and postpartum anxiety. Usually my way of coping with anxiety, especially during my university degree, when it was very stressful for exams and papers, was to run. It's one of my favorite pastimes. I've done 5Ks, I've done 10Ks, I somehow trained for a half marathon, and I've made it up to a 38-kilometer trail run. And exercise gives you endorphins, and as Elle Wood once said in Legally Blonde, endorphins make you happy. And they should. And after I'd go for a run, I would get that elevation and I'd feel elated. And then I'd walk back in the door and everything would just come right back on my shoulders. Postpartum anxiety and depression, although you can run for your mental health, it's not something that you can outrun. It's going to find you in the sneakiest of ways, whether it's 2 a.m. up with your baby, trying to get your kids ready for the bus stop, trying to just plow through life. And then let's just add a pandemic on top of that and see how it goes. So for me, the best way that I was able to deal with this was by doing something really, really hard, and that's talking about it. Seems kind of silly, seems kind of stupid. I called my doctor after having a bit of a panic attack watching my kids swim in a pool. No one was drowning, no one was hurt, just me sitting there watching them. Intrusive thoughts came right into my head. I was lucky that I had a friend nearby who kind of noticed that I wasn't just being a grumpy bitch. I needed help. So I picked up that phone when we got home from our trip, and we were out of the swimming pool, of course, and I called my doctor to talk about it. Dealing with postpartum depression, anxiety, and rage doesn't mean that calling your doctor is going to result in needing medication and that's going to be the answer. It means a lot more than that. It means finding the right medication, whether or not that comes in the form of pills or therapy or a combination. There's so many different things because every person is an individual and has their own unique experience, their own resources, their own children, and it varies so much. But in my experience, the hardest part was calling my doctor, asking for help, and trying to talk about it. Thank you for tuning in, everybody.